On October 10, 2012, the Health Council of Canada welcomed over 375 delegates to its annual symposium, Advancing Integrated Healthcare in Canada, Practices That Work. The chair of the National Symposium on Integrated Care and the vice chair of the Health Council of Canada, Murray Ramsden, delivered his closing remarks, including his own insights on the day.
Boy, that was an information-packed day, and I know I'm feeling a bit of the exhaustion from the day, just trying to absorb everything. I want to first start by thanking the presenters, the really quality presentations that we had today. And to thank you, the participants, for really your questions and answers, because you really got everybody involved. So a hand for you as well. And I don't want to reiterate everything Ingrid said, but the day, to me, when Dennis Codner started off the day and he was sort of priming the pump, he got us really sort of excited and provided that overview and left us with that thought of courage. And then we got into the panel, and Charles Wright, and the moderator, just as we were wrapping it up and we were all sort of wondering, boy, we're running late here, because there were so many questions coming from the audience. If you remember, there was a lot of discussion. We thought, well, did we let it keep going, because we're on a roll here, but if we let it go, then we're going to be much later as we go on through the day. And then Charles had to throw in the enablers and talked about the distasteful, sometimes necessary changes that are going to be having to occur if we're going to enable integrated care to really take hold in this country. But then I got into the concurrent sessions. And as Ingrid said, I got really excited. I came away with a lot of great ideas, and I thought, I just wish I could have been in that session and that session, and probably many of you are in the same boat. And I know that's where we're going to have the opportunity later to go on to the website and to start pulling up some of that information that we weren't able to necessarily participate in. When I was listening to the Honourable Fred Horn, of course, I come from the province just west of his, and I often, of course, having done some work in Alberta Health Services, and I know many of the people there, and you often look at what's going on next door, right? Because our policies between provinces and territories and the federal government, we all intertwine. I mean, what happens in one area eventually comes across to another, and particularly in Western Canada, there's a lot of interaction about what's happening and who's doing what and how can we move the goalposts ahead. And so I was very impressed, and I was also very impressed with his background, being in the district health councils and then working with the Ministry of Health here in Ontario, and that gave me a little bit better understanding of where he's coming from. So I think it's important. Let's stay in touch. We got the Health Council website. We're able to go on that. You can sign up for the monthly newsletter, which will keep you up to date of what is going on a variety of issues. You will be getting information, of course, on the sessions. You'll be able to go on to the website. You'll see the plenary sessions. You'll be able to get information, the presentations anyways, on the concurrent sessions, so you can grab that information. And I think as we leave here, I think it's important that we all sort of try to stay somewhat in touch. You're going to have the participant list, so you'll have people to contact. All the presenters left their information for saying, hey, contact me if you have any questions, and I think that's very important to sort of follow up on those areas. And again, following up with Dennis Codner's comments about, as we leave here, have courage and be a brave lion as you go forth. Thank you very much, and I hope to see you next door at the reception area.
Visit healthcouncilcanada.ca/symposium to watch more videos from the Health Council's National Symposium on Integrated Care.